Welcome, everyone, and thanks for tuning into our Stocks to Watch series, your trusted source for investment information. I'm Ashley Berry, and we're here to discuss personal home care and support services. Chris Dobbin, President and CEO of Nova Health Corp, is joining us. Listed on the TSXV as NLH, Nova Health performs a vital role within the continuum of care with an individual and family-centered focus, particularly those requiring dementia care. Chris, welcome to the show.
Thanks, Ashley. I appreciate having me on.
It's always a pleasure. I'll start off with some pretty impressive rankings here. Nova achieved the #2 ranking on the 2020 report on business of Canada's top growing companies and the #10 ranking in the 2019 TSX Venture 50 in the clean technology and life sciences sector. Congratulations to that.
Thanks very much. I mean, it's really a credit to the team that we have. We've been growing, quite substantially over the years since our inception, and I think the rankings reflect that.
Great. Well, Canada is experiencing a notable increase in its aging population. The senior population is projected to rise to 24% by the end of the 2030s, up from 18% in 2020. So a similar trend also here in the US. Tell us about Nova Health and the services it offers to the elderly and why those trends are important for your company.
Yeah, no, I think in order to understand our company, I think most people understand the demographics that we face. I mean, we have an aging population, and again, that's easy for everybody to understand. And so, we basically go into a senior's home and we help provide activities of daily living, really with a focus on dementia. So about 75% of our clients they live with some form of dementia, and that's really where our focus lies. And so, we deal with a lot of veterans. We deal with former business owners, executives, just family members, anyone that really needs help within the home, whether it's security, safety, getting around, meal prep, so on. Lots of stuff that we do, but ultimately, we're providing care within someone's home, and it's a pretty rewarding experience for us.
And I think everyone can truly relate to this. We all have somebody in our lives that may need this care, or at least that is aging. Of course, we're all aging. According to some estimates, the demand for home care is expected to increase to about 1.8 million patients. That's up from nearly 1.2 million in Canada. Those are big numbers. A similar preference seems to be present in the US, credited by the pandemic. So why is it better for seniors and their family members to receive this type of care at home rather than stay in nursing homes? And why do you think patients choose your care services over others?
Well, I think home care is so attractive because, and the surveys would say this, I mean, most people want to stay within their home. I mean, upwards of 95% of those surveyed would indicate that's the case. And, the question is why is that? And I think it comes down to people's comfort with where they live and the memories they've created. If you think about you're in a home and you're a senior, your family's grown up there, so you have all those memories of growing a family. You've hosted parties or graduations, and a lot of your life is centered around your home in some capacity, and so it's really a comfort level, and that's why I think people want to remain where they've been most comfortable, where they have all the great memories they can kind of reflect on, and I just think that's why it's so attractive. In terms of why people would select one of our agencies where we operate, and again, we're in Nova Scotia and we're across 10 states in the US, I think it comes down to our focus on dementia. I mean, we're really an organization that's centered around providing training to our caregivers around dementia. And like I said, 75% of our clients live with some form of dementia. So, that tends to be why, the adult children tend to call us in for support. So, I just think the training and the particular focus around dementia is why we've been attractive agencies for where we operate.
And, I have to mention, and I like that you mentioned the caregivers because, their role is so critical in this space. As for the demand for your services rise, are you likely to require a large trained labor force? And how do you ensure the availability of this much needed workforce, considering also the competition for talent?
Yeah, we are. I mean, our caregivers, in many respects, we actually treat them as our first set of clients, right? Because they're so important to the delivery of our care within the home. And there's really two things we focus on. One is obviously recruitment, and the second is retention. I mean, recruiting is an ongoing effort because we need good quality caregivers to provide the service. And then obviously to retain those great quality caregivers, we need those in order to provide the service. So sort of goes hand in hand, and it's continual focus. And how we make sure we get that right again is really providing training that usually they just haven't received in the past. When I make the tours to agencies and I talk directly with caregivers, the I would say the number one item that comes up is how thankful they are for the training they've received. Because as much as it's easy to understand the nature of the work we do deal with complex situations with a home. When people have dementia, it's a challenging environment, and so when caregivers have been properly trained around that challenging environment and the things that they could expect to see within a home, it goes an awful long way providing the right type of care.
And we all know the role that caregivers play, but if we can maybe break it down to the actual services that you provide, are you able to just briefly describe that for our audience?
Yeah, sure. I mean, it could be as anything from light housekeeping, meal prep, transportation, errands, personal grooming or bathing, helping them with a shower. Oftentimes, that individuals live with dementia, they actually get up in the middle of the night. It's like their internal clock oftentimes gets reversed, and so if they have a loved one that wants to sleep, we can have a caregiver, do overnight shifts as an example to help deal with the individual that maybe is getting up in the night so his or her spouse can sleep. So it's really wide ranging, but you start to think about safety and security. Falls are a common issue, but it's there's a list of things on the non-medical side, and non-medical is primarily where we focus. We do have nurses on staff, and so there is some medical work we do, but activities of daily living and that personal care is really where we focus most of our energy.
Wonderful. What are you hearing from the patients and from patient families about the services that you provide?
Difficult situation for family members to be in, and really, I founded Nova Leap on having gone through a personal situation with my father-in-law who had dementia. And so, it's important to me because we experienced, this as a family, and that's why we know the impact it has on families. And so you think about, we've often heard the sandwich generation where you have individuals that are looking after the kids and also having to look after their parents. And it's time consuming, it's difficult, it can be stressful. And so it's really, I think families are just thankful that there's a service out there that really helps them on with one aspect of the family dynamics, and we're thankful to be part of that journey. So it really goes hand in hand from that perspective.
Yeah, truly a novel mission. Thanks for sharing your personal story with us, Chris. Let's talk about the financials, the company, the revenue. Where do you stand right now?
So if we're looking at a quarter-over-quarter basis, a couple of quarters we were up revenue. Last quarter we were slightly down. From an adjusted EBITDA perspective, and these fluctuations, by the way, are just normal course. So if you think about the nature of the clients we serve and sort of the hours, they could be anywhere from, say, a 4-hour shift to 24/7. And so if we have a 24/7 client that leaves us or comes back, depending on the fluctuations there, that can have an impact on the hours and how we bill. So we're not Medicare, Medicaid, we're private pay space. But there's sort of the natural fluctuations. And then from an adjusted EBITDA perspective, we put together back-to-back record quarters for us. So, the pandemic was a challenging time for us, and we've come out of that actually quite well with record results. And so we're on a good track record, no debt to speak of. And so we're sort of back in growth mode as we enter into 2024.
Fantastic. And for those watching, for our audience, what kind of forward guidance can you offer to, say, current and future investors, and why now is the right time to invest in Nova Leap Health?
Yeah, look, I think now is a great time, and it goes back to history. We've been an acquisitive type of company, meaning we have tended in the past to acquire about one home care business every quarter, and we've done that up until the end of 2021. We put a pause on that during the pandemic because we have no debt and we're producing good, strong cash flow. We're in a position to go back and make acquisitions into 2024. So if investors believe we can do that, and they take a look at where we are right now and where we could be by the end of 2024, it becomes a simple math equation, which would certainly leads me to believe that we could be much more highly valued by the end of 2024 versus where we are today.
Wonderful. You know, as I said earlier, this is an issue. This is something that everybody, I think, can relate to. Chris Dobbin, President and CEO of Nova Leap Health Corp. Thank you for your time, for sharing your important story here on Global One Media's Stocks to Watch, and we look forward to sharing additional updates with our audience. Thanks again, Chris.
Thanks, Ashley. Appreciate it. Thank you.